Coronavirus is infecting more children than ever in our state and sending them to the hospital. The latest available data shows 70 children were hospitalized just this week in Michigan with severe COVID-19 symptoms. That's double what we saw during the worst days of the second wave last November. The age group with the highest rate of new cases in Michigan, 10 to 19 years of age, with an average of more than 1,100 per day. Priya Mann has more on this very troubling trend. And Priya, this really underscores a message doctors have been trying to get across to patients.
Yeah, that's right, Kim. Doctors say if more adults don't get vaccinated and we don't reach herd immunity, more kids will get sick and end up in the hospital. The chief of pediatrics at Beaumont says he's worried about some kids developing other health issues. The chief of pediatrics here at Children's says they haven't lost a single patient to COVID. Of course, statistically, kids will recover more quickly, but both health officials are deeply concerned with the troubling trend.
Parents have a lot of questions. They're like, why is my child affected? When did he get the COVID?
A staggering 1,500 pediatric COVID cases are being diagnosed every day.
A lot of the kids we see are otherwise healthy. They're perfectly fine, and then they are in the ICU and getting all sorts of aggressive medications to try to reverse the process.
In Michigan, the rates of child infections are higher than at any other point during the pandemic. Doctors say there's a variety of reasons at play, including the highly transmissible UK variant, schools reopening, and kids under 16 being ineligible for the vaccine.
We're seeing more than we did previously. In terms of these COVID pneumonias in adolescents,
a particular concern is children developing multi-system inflammatory response syndrome, or MIS-C.
That is a scary condition. The reason it's scary is because no one really knows why it happens.
MIS-C affects the heart, brain, and kidneys.
Nobody can guess as to which children would get that versus which ones wouldn't. They may have had COVID maybe a while ago and they were not symptomatic, and then boom, several days later, they're presenting with those symptoms.
Doctors are urging adults to get the vaccine.
We are in a public health crisis. They should seriously think of doing it as a civic duty for the population, for everybody around them.
Now, when it comes to vaccines for young people, doctors say there's currently a vaccine for 12 to 16-year-olds that should be approved within the next few months. And there's another pediatric vaccine that's being developed that could be administered to children as young as 6 months. That could happen within a few months as well. But again, the bottom line from doctors here, if you're an adult, get the vaccine to protect your kids. Reporting live from Children's Hospital, I'm Priya Mann, Local 4.
Okay, Priya, thank you.